Out of Self and Into Others, an examination of altruism and pro-social behavior as a treatment for depression and anxiety by Jaime Manfredonia. Depression and anxiety affect over 40 million people in the U.S. each year and have a high comorbidity. Individuals that suffer from either can often experience a poor quality of life. While both are highly treatable with many options, only a little over half seek conventional treatment. Personally, I've gone through periods of troubling depression and still suffer from symptoms of anxiety. It can take a lot out of you and impact close relationships. Yet, I have found a way that works, and hopefully others will too. Have you ever been depressed or experienced a period of anxiety? Is this something that troubles you more often than not? Or perhaps a friend is struggling and you'd like to recommend something they can do to start feeling better. This presentation will explore engagement in altruistic and pro-social behaviors as useful additions into treatment programs for anxiety and depression. There are several types of depression, but the predominant feature is a disturbance in mood. Major depression occurs in episodes of persistent low moods or sadness that are severe enough to impede on one's interest to engage in normally enjoyable activities. Episodes must last for at least 2 weeks, impair normal functioning, and are not due to a major life event. Dysthymia, or persistent depressive disorder, presents similarly to major depression, yet the symptoms are less severe. However, they are chronic and usually last 2 or more years. There are several other disorders which include depression and depressive symptoms. Depression as a symptom can occur after positive or negative major life events such as marriage, divorce, having a child, the loss of a loved one or a job, interpersonal issues, or financial stress. Depression can also co-occur with medical conditions such as cardiovascular disease, diseases of the central nervous system, and cancer. Depressive disorders are some of the most common mental illnesses in the U.S. Slightly less than 7% of the population have experienced at least one depressive episode in a given year. It is important to note that depression doesn't only look one way. Mood disturbances can result in changes in normal functioning, including eating too much or not enough, sleeping more or less, problems with energy and concentration, and alterations in self-image. Additional behavioral tendencies can include social withdrawal, isolation, and a decrease in activity. Other than the overt changes in a person's everyday functioning are the troubling mental and emotional aspects of the disorder. People suffering with depression commonly experience a negative view of the future and the world, feelings of guilt, shame, worthlessness, and sense of inadequacy, low self-esteem, and self-loathing. Anxiety disorders are characterized by heightened physical arousal, cognitive distress, and behavioral avoidance of feared objects or events. These disorders generally present in different ways and result from different objects or situations. Each year, about 18% of the population in the U.S. is affected by an anxiety disorder, with a 31% adult lifetime prevalence, which makes this group of disorders another of the most common. A staggering 57% of those who suffer with anxiety are affected by another anxiety disorder or depression. As with depressive disorders, there are several types, many of which are popularly known, such as generalized anxiety disorder, social anxiety disorder, obsessive-compulsive disorder, and post-traumatic stress disorder. Generalized anxiety disorder is the broadest of these disorders, the cornerstone of which is excessive worry, which occurs on most days and for at least 6 months. Worries can include those about the past or future, finances, personal health, or that of a loved one. People report feeling as if these thoughts are uncontrollable. Interestingly, sufferers believe that worrying may help prevent or avoid negative consequences. Troubling physical symptoms such as muscle tension and fatigue are accompanied by cognitive symptoms such as trouble sleeping and concentrating, restlessness, and irritability. Similar to depressive disorders, anxiety can be brought about by unexpected negative life events, trauma, loss, or prolonged stress. Social anxiety disorder is characterized by the fear of people or of social situations. It can include fear of eating, drinking, and engaging in social interactions. The belief that one will somehow embarrass themselves is pervasive. Worries are excessive and fears are unreasonable, considering the actuality of the situation. Behaviorally, temporary relief from stress is sought through avoidance or escape, and this reinforces these negative tendencies. Physiological symptoms of anxiety are those which result from the activation of the central nervous system, otherwise known as the fight or flight response. Under real conditions of threat, these responses are adaptive. The release of cortisol and adrenaline increases heart rate, blood pressure, respiration, sweating, and tension. Over time, continued exposure can lead to health issues. According to Moeller and colleagues, approximately 85 to 90% of patients with anxiety experience depression and vice versa. Consequently, there is a debate on whether a new diagnosis should be added to the International Classification of Diseases of mixed anxiety and depressive disorder. Supporting arguments propose that high symptomatic co-occurrence warrants a separate classification for better treatment outcomes. Patients with both disorders are prone to greater suicide risk, impairment, treatment resistance, and other disabling issues than those suffering from one condition alone. From a public health standpoint, depression and anxiety-related issues cost well over $83 billion annually, as estimated in the year 2000. They are linked with increased use of healthcare resources, hospitalizations, decrease in work productivity, lost work days, and billions of salary hours, unemployment, and other disabilities. Mortality rates, as well as consequent development of other illnesses such as stroke and heart disease, are increased. The father of psychology, Sigmund Freud, viewed depression as anger turned inward. He proposed anxiety was due to inner conflict and repression of impulses. Perhaps more consistent with modern theories is Bandura's social learning theories. It identifies a reciprocal interaction between behavior, cognition, and environment. These elements are dynamic. The individual's choice perception of a situation in turn impacts behavior. Behavior can modify the situations in which a person finds themselves, thus influencing how they see the world. A key component to the discussion of depression and anxiety is self-efficacy, defined as one's ability to engage in appropriate behavior in a given situation. Issues arise when perceived self-efficacy, or what an individual thinks or expects they can do, undermines what they are actually capable of doing. People with these disorders tend to overgeneralize expectancies, which means they have distorted ideas of self-efficacy, and so create and experience confirmatory events which reinforce dysfunctional thoughts and behaviors. Similarly, cognitive theory posits that people respond to life events through a combination of cognitive, affective, and behavioral responses. The cognitive component is how the individual perceives, interprets, and assigns meanings to events. Problems arise from faulty processing in the way new information is incorporated. Depressives can exhibit a negative view of self, world, and the future, and those with anxiety tend to selectively interpret themes of danger. Cognitive theory aims to identify dysfunctional beliefs and errors in cognitions in order to override and alter maladaptive responses. Prosocial behavior is any behavior that is intended to help or benefit others. Altruism is defined as unselfish regard and concern for the well-being of others. Examples are volunteering, donating time or resources, and providing interpersonal support. Helping behaviors can be simply of a social nature and not of tangible resources such as money or material items. What are generously given are resources of the subjective self, not simply extrinsic or easily objectifiable, and include attention, compassion, open-handedness, and verbal expression. Batson's empathy altruism model posits that people help others purely for the sake of providing assistance to someone in need. Batson and colleagues claim that empathy is what provokes the ultimate goal of increasing the welfare of the person in need. In other words, a real concern for others results in selflessness and true altruism. Empathy is brought about by perspective taking, which is considering another's point of view in a situation. This reaction is characterized by compassion, sympathy, and tenderness. Various studies provide evidence that situations which invoke perspective taking will induce empathic concern, which results in more frequent and altruistically motivated helping behaviors. However, some social psychologists believe there are no true altruistic motives, and there will always be a self-centered reason for helping someone else. Pro-social action is susceptible to a plurality of motives. In describing egocentric drives, it has been hypothesized that people are motivated to help because of unpleasant vicarious emotional responses, and the act of helping will alleviate some level of personal discomfort to the bystander. Only empathy results in action that is thought to truly aim to reduce distress in another. There is already a large body of research on recipient benefits of helping in pro-social behaviors. However, there are plentiful paybacks for those who engage in pro-social behavior. In a literature review, Post identifies connections between altruism and greater welfare. Kind emotions, helping behavior, or both are associated with well-being, health, and longevity. Post also cites the works of others in the field, such as Fredrickson, Lawler, and colleagues, and Sternberg, which agree that emotional states of selfless love, kindness, and other-centered affections can combat the negative emotional states of fear, anxiety, and stress. Further studies point out the same. Altruistic emotions can mediate the physiological fight-or-flight response experienced by those suffering from anxiety. These positive emotions and changes in physiological state can be called the helper's high. Pierce and colleagues examined whether generosity could be differentially influenced by either secular or religiously based cognitive behavioral therapies. Both treatments were traditionally grounded. The only difference between groups was whether religion was used as a means to inspire and practice new behaviors. Both groups were encouraged towards acts of forgiveness, gratitude, and altruism. Perhaps not surprisingly, both groups showed increased generosity from baseline. And most importantly, increase in generosity over the treatment period was positively correlated to a decrease in depressive symptoms. Schwartz, Meisenhelder, Ma, and Reed analyzed responses from over 2,000 Presbyterian church members across the United States. They found dimensions of depression and anxiety within a clinically normal population were improved and positively correlated with helping behaviors. Schwartz and Sendor studied the impact of providing peer support on the physical and psychosocial well-being in people with multiple sclerosis. Over a one-year period, lay people with MS provided phone support to others with the condition. They were trained in active listening, displaying compassion, and unconditional positive regard. Results were largely in favor of peer supporters. Over a 2-year period, they reported notable positive enhancements in confidence, self-esteem, self-efficacy, life satisfaction, personal growth, and purpose. They also experienced less depression, physical limitations, and fatigue than the supported group. Authors reference a shift from a self-oriented focus to an outer directive role that allowed them to disengage from prior patterns of self-reference and to reframe their own experience. Reisman's helper therapy principle suggests that the act of helping another often heals the helper more than the recipient. This concept is a main tenet of the 12-step program of Alcoholics Anonymous. Program literature asserts excessive self-focus as a part of the cognitive troubles alcoholics face. Quote, "We couldn't control our emotional nature. We were prey to misery and depression. We had a feeling of uselessness. We were full of fear. We were unhappy. We couldn't seem to be of real help to other people." These ideas are what make altruistic behavior absolutely necessary for long-term sobriety. In a review of the helper therapy principle in the realm of AA, Pagano and colleagues reiterated data which found that alcoholics in treatment who helped their fellows were more likely to stay abstinent over 1 year's time and experienced a decline in depressive symptoms. Duarte and Pinto Govia sampled mainly female college students in regards to interpersonal goals and psychosocial well-being. Focus on self-image, such as those attempts to ensure desirability, acceptance, and inclusion by others, were associated with higher levels of psychological distress. Students who focused on helping others experienced fewer symptoms of depression and anxiety. Researchers posited that hormones such as cortisol may be activated as egocentric self-image goals are threatened, producing greater anxiety, depression, and stress. Lowered depression levels in those focused on others was mediated by the activation of positive affect from feeling connected, close, and supported. Within an extensive review of the literature, Penner and colleagues analyzed the macro level of helping and pro-social behaviors. Evidence supports the constructive impact that volunteering can have. It can aid in the development of pro-social identities and attitudes, positively impact self-esteem, academic achievement, personal efficacy and confidence, as well as decrease levels of dangerous and antisocial behaviors. In the elderly, volunteering is shown to improve quality and duration of life. Sakamoto suggests that self-preoccupation is a vulnerability factor or prerequisite for depression. It is defined as the tendency to focus more on self and to maintain it for a longer period of time. In studying the relationship between preoccupation and depression in college students, Sakamoto found that those who are more self-occupied became more depressed when experiencing a negative life event. Interestingly, he also identified that the ability to turn attention away from self was more difficult and stabilized and reinforced a negative mood state because positive and contrary experiences could not be accessed. Certain negative mood states such as guilt, shame, and sympathy can increase social behavior, while sadness, failure, and personal rejection decrease or don't affect it. Perhaps not surprisingly, when one is focused on someone else's hardships, altruism increases, and when remaining focused on their own issues, personal sorrow increases. Dysfunctional and maladaptive thought processes, high preoccupation and egocentric reflection, social isolation, feelings of inadequacy and uselessness are all significant elements of depression and anxiety. The tendency to isolate, withdraw from, or avoid normal activities can be detrimental to having new and positive experiences. What can we do to help? Helping someone else may be an effective treatment. In promoting pro-social altruistic helping behaviors, people with depression or anxiety may find a treasure chest of positive changes. By assisting another, one's perceived self-efficacy can be adjusted and brought to a more functional level. Experiential learning will allow for awareness of what one is actually capable of doing in a supportive environment. Feelings of inadequacy and uselessness would be reduced. Positive feedback from such experiences will help rearrange and correct cognitive distortions and negative beliefs about self and the world. Social exposure gained from helping others allows for the development of closer relationships and the opportunity to learn that no one ever has to be alone or isolated, mentally or physically. It was found that those with depression may actually possess higher altruistic standards, perhaps making them better suited for helping. Acting on their empathy for others, sufferers may learn to extend empathy to themselves. Those with a shared illness or disorder may find helping their fellows to be doubly rewarding as they learn how others cope with a variety of problems. The physical benefits of altruism also combat the physiological distress caused by heightened cortisol levels, creating reinforcement for helping behaviors. Medical and mental health professionals, as well as lay people, should become aware of this information. Suggestions or assignments should be made to patients in treatment. Informational pamphlets given out in such offices should include some facts and advantages to helping others. Pro-social behavior doesn't only consist of community cleanups or food drives for the homeless. It is behavior that helps your neighbor get out of their own way. Behavior that can help you be a better you. Altruism is key to living a happy and productive life. So ask yourself, who have you helped today, and how do you feel about it? Thanks for watching.